So the question always comes up as far as sharing health information, the question of privacy. How do you answer the question of privacy in this issue?
So the consents that are in place today for treatment that most of us sign when we go to see our physician, we go get a lab test at a hospital, will cover this sharing of information. Clearly, there is a lot of variation from state to state on how patient consent is handled today. Patient consent, privacy, security from a federal level, I think we need better policy. Perhaps we need policy, period, around that. And I'm really looking forward to the work that Devin McGraw and Rachel Block are doing with their privacy and security work group that's a part of HIT policy, because I think they're going to tackle the tough issues and come up, with a framework and a policy that can go through the federal system, HIT policy, the ONC offices, and give a lot better guidance than what we have today.
Now, have you specifically partnered with any of the EMR vendors, or give us an example of an EMR that works real well with your system?
Well, we have virtually integration with every EMR vendor that's out there. We have very good partnering with Allscripts as an example, to one of them that we have a closer relationship with. But virtually every EMR vendor out there, we've, with our approach, can do the integration. We built it, and we're ready to go.
Great, great. So we have some feedback or questions there?
Okay, we've got some live questions here from our chat room. David Harlow asks if you were bought by IBM yesterday. Is that right?
That's true.
Okay. Wait, and how does their service integrate with how does your service integrate with IBM offerings?
So it is true. We were purchased by IBM yesterday. It was finalized. So we are Initiate, an IBM company. We're going through the transition and integration planning. Obviously, it's not even 24 years old, or 24 years, 24 hours old even. So, we're doing that planning. We're really excited to be a part of them. We've clearly got a great customer list and some solid references out there and some great experience. We've worked with IBM on their NHIN 1 and NHIN 2 projects. We worked with almost all of the NHIN 1 and NHIN 2 projects. So, we're kind of off to the races, shall we say, and it's going to be a fun exploration here to figure out how we can do even more to help healthcare.
Great, great. And more.
Okay. Beyond identity management, do you also offer the ability to share radiology results?
Yes. So when it comes to sharing results, we'll share lab discharge summaries, radiology reports, radiology images. We will partner at times with portions of that, particularly because when you talk about radiology images, then you're getting into all sorts of modalities. So we will use partners to do portions of the radiology.
Great. Didn't know you were going to get all these good questions, did you?
There's so many. I'm trying to distill. How about mobile use? As a nurse practitioner working in the community, for example, would there be overlay there?
I know that some of our EMR partners have mobile technology, that they can show results and other things. Images on mobile technology. I have to confess, I can't give you the details of that, though. But certainly it's a trend in healthcare to make life easier for physicians and everybody else who's delivering care.
Absolutely, absolutely. Well, this is a flurry of questions that Dr. Val's trying to translate here for us and distill down here. So,
Well, connected care is obviously very big, and it's very important because we don't get care in just one place. We have specialists and primary care physicians. So not surprising you have a lot of questions.
Sure.
Is your technology open source?
No, it is proprietary. We will use some open source components. We will certainly partner with open source. We've done the connectivity to the NHIN gateway. So we certainly work with open source directly and indirectly.
Okay, great. Good. So I guess in closing here, I mean, there are some competitors in this space. So why would somebody want to consider Initiate systems for their solution?
I believe they would consider us our vast experience. We have well over 100 healthcare clients. our what we would say time to value quick implementation. You can be live with Initiate in anywhere from 2 to 6 months based upon the resources and the scope of the project, obviously. And then accuracy and scalability. If you want to get identification right, and I think everybody says they do, I certainly as a healthcare consumer hope you do, we can manage scale from 100,000 to several billion records we do in deployments. And you want to do that right, and you want to do it right the first time.
Great, great. So for people who are here at HIMSS watching us here right now, where can they find you on the exhibit floor? And for people who aren't here, where can they find you on the internet?
On the exhibit floor, we are in the B Hall space, 7033. The the internet address would be initiate.com.
Great, great. So Lorraine Fernandez from initiatesystems.com. So thank you so much for the time here this morning.
Well, thank you for the offer.
And Better Health coverage live here at HIMSS 10 will continue in a few minutes. We'll be right back.